on a social media platform, as well as collecting money from the organization, the patient, and CMS insurance? What? Are we like double dipping? And the patient does have to be given informed consent if there is recording that's happening. And unfortunately, it is the nurse who has to say, was this patient consented for this? Because you cannot live stream the anesthesiologist, the nurse anesthetist. Everyone in the room has the duty, most certainly the nurse, unfortunately, leading the time out. But again, we haven't even got to this poor nurse. But we cannot allow the doctor or anyone to be live streaming unless the patient has been given informed consent and it is on their consent form. I worked in procedural areas. If there's even going to be a rep in the room, that has to be put on the consent form. The patient has to be given informed consent. I just see things differently. I was just baffled by that. Now let's move into him berating the nurse on live stream and then going back to delete that piece of it where he does berate her. This is part of the patient's medical record because it would have to be part of the patient's medical record, right? Because you're not live streaming anything that's not part of the patient's medical record. Is that not alteration or deleting a medical record? Whoa, folks.